in doing sexual intercourse. As early as 12 years old, they have been involved in doing the act. However, they are not aware of the consequences that will cost them. Most of the girls get pregnant and become teenage moms with unprotected sex. Both men and women get sexually transmitted infections such as HIV, genital warts, cervical cancer, syphilis, and the like. So how does sexually transmitted infection spread and how do you get it? People get sexually transmitted infections through sexual intercourse with their partners who are infected. They can also get it from having multiple sexual partners engaging in oral sex and anal sex as well.
Here are guidelines for safe sex to reduce risk of spreading sexually transmitted infections. It is always smart to talk about sex with your partner, a peer educator, or a healthcare professional before you make the decision to have sex. While sexual intercourse always involves some risk of pregnancy or sexually transmitted disease, there are definitely ways of making your sexual experience safer. Here are 10 simple things you can do, say, and think about now before you have sex. Don't feel pressured to have sex or have sex out of fear. Fear of hurting someone's feelings by saying no, or fear of being the only one who isn't doing it. Virtually everyone wants to fit in with his or her friends, but you should never compromise your values to be part of the crowd. If you don't want to have sex, be honest. Discuss the reasons behind your decision with your partner and stay true to you. Don't abuse alcohol or use drugs if you think things could get physical. Drug use or alcohol abuse interferes with decision making, which can lead to date rape, forgetting to use contraceptives, or contracting an STI. The lowering of inhibitions that often accompanies alcohol use might make you think you'll enjoy sex more. But in fact, for a variety of biochemical reasons, too much alcohol actually makes sex less enjoyable for both men and women. Use the bud system. If you go to a party or a bar, go with friends and keep an eye out for each other. Agree that you won't live with another person without telling someone. Sometimes a friend's second opinion could help you prevent you from making decisions that you might regret later. The best protection doesn't mean less affection. Abstinence is actually the most effective way to protect against STIs and prevent pregnancy. But practicing abstinence doesn't mean you can have intimate physical relationship with someone. It just means you don't have a vaginal or anal intercourse. There are many other ways to be intimate and not have intercourse. Just be aware that alternatives like oral sex carry their own risk. Be prepared for a sex emergency. Consider carrying 2 condoms with just in one case breaks or tears while it's being put on. Both men and women are equally responsible for preventing sexually transmitted infections using contraceptives, and both should carry condoms. Sometimes things go wrong even when you try to do everything right. Women should also know that about emergency contraception or EC. Taken within 72 hours of intercourse, EC may prevent pregnancy.
Talk smart sex first, have smart sex later. STIs and unintended pregnancies affect both partners, not just one person. If you feel uncomfortable discussing sex and birth control with your partner, then you shouldn't be having sex. Be straightforward and talk about sex beforehand, so both partners know what to expect. It's easier to be rational and reasonable before you're in the heat of the moment. Two are better than one. To help prevent both pregnancy and STIs, you should correctly and consistently use a birth control method like pill, no means no. And pass out doesn't mean yes. Being drunk isn't a defense for committing sexual assault. If you are too drunk to understand a person trying to say no, if you are too drunk to listen and respect a person saying no, or if you have sex with somebody who is passed out or incapable of giving consent, it can be considered rape. Respect everyone's right to make his or her own personal decision, including yourself. There is no imaginary deadline, no ideal age, no perfect point in a relationship where sex has to happen. If your partner tells you that he or she is not ready to have sex, respect his or her decision. Be supportive and discuss the reasons behind. It is everyone's ultimate right to decide when and how they have sex, be it the first time or the 10th time. Lastly, make sexual health a priority. Whether you are having sex or not, both men and women need to have regular checkups to make sure they are sexually healthy. Women should have annual gynecological exams.
Wear a condom before intercourse. Check expiry date. Do not pull the condom before putting it on. Pinch the tip of the condom to remove air. Unroll the condom to the base of the erect penis.
Pinch. Saan ka galing? Ba't ganyan amoy mo? Uminom ka na naman, no?
Kailan mo ba mag... Eh!
Hindi ka. Aray!
Hindi ka na ba?
Ayaw kayo. Hindi, lapit mo yung...
Ay.
Mali. Halika pa manapon eh.